morning. Let's go ahead and get started. Welcome to the second lecture of our spring lecture series for the Center for Children and Families.
Doesn't sound like the mic's working.
It doesn't sound like the mic's on. I'll use this one for now. All right, how about this? Is this, ooh, yes, I can hear it now. All right, welcome to the second lecture of the spring lecture series for the Center for Children and Families. I am pleased to welcome Dr. Cynthia Frosch today. Dr. Frosch is currently an assistant professor in the Department of Educational Psychology at the University of North Texas. Dr. Frosch has been actively involved in research and outreach broadly related to healthy parenting and parent-child relationships. In one previous project, Dr. Frosch worked with our Center for Children and Families director, Dr. Owen, to direct and develop an instructional video and workbook called The Ready Method, From Birth to 3, a visual guide to sensitive caregiving. The video clips for this are fabulous because they show some examples of sensitive and less sensitive parenting, ways to work with children, and they're amazing. A really good idea to show the visual of how to interact with kids or how to think about interacting with kids. In other projects, Dr. Frosch has examined stress and coping among early childhood intervention professionals and attachment and emotion and parent-child dyads. Before joining UNT, Dr. Frosch was affiliated with UTD and the Center for Children and Families. She taught several important classes for us, many of them core courses for our master's program in human development and early childhood disorders. I should mention that one of my previous doctoral students was a TA for her and loved teaching for that class. And it sounds like her students at UNT also appreciate her as a teacher. On ratemyprofessors.com, which you know is a completely objective source of information, but I looked, they were all positive. She got positive reviews on ratemyprofessor.com. One of them described her as one of the best professors she's ever had. And another student said, I never had any trouble paying attention, but also added this class is my favorite by far. So I think those are pretty rave reviews. I also say Dr. Frosch has always been very supportive for the Center for Children and Families, helping out with different kinds of things and attending lots of different events, and we've really appreciated that. A common theme to all of her work through teaching, research, and outreach is the emphasis on understanding caregiver-child relationships with a constant eye on innovations and approaches to help strengthen relationships. Today, Dr. Frosch will speak about some of those issues with a talk titled, A Relational Health Perspective on Early Development. Please join me in welcoming Dr. Cynthia Frosch.
Laughing about the Rate My Professors. I try to avoid looking at that at all costs because I hear that sometimes they're pretty harsh reviews, so I'm glad that Candace did the filtering for me. All right. So let me get organized here, make sure we're good. It was fun to put this talk together because we, UNT and Center for Children and Families, shares a common kind of green, that limeish green kind of color. So it was kind of fun in thinking about how to blend our two worlds together. As Candace mentioned, I spent some time here at UT Dallas, and I had to say when I was driving this morning, it seemed like the number of buildings, I think I mentioned, felt like it had quadrupled. I had no base for where I was, and finding the parking structure was kind of a fun maze. But I'm really grateful to be here, to be back. In many ways, it feels like home to me. I've enjoyed my time working with the Center for Children and Families over the years, and I'm excited to share some of my research and practice work around emotional connection. And I want to start by first recognizing all my relational partners who are in the room. I see so many of you, and it's so great that you came out today. And I can think back on the ways that you've mentored me and interacted with me and helped shape this talk in so many different ways. So always important to start about how you got to this point, right? And I got to this point through training as a developmental psychologist. I did my graduate work at the University of Illinois in Urbana-Champaign, but before I got there, a curious thing happened. I was sitting in statistics, trying to find ways to pay attention very well, which is challenging, right? We're doing sums of squares, analysis of variance by hand, and so forth. And the strangest thing would happen. Across the hallway, babies would be crying a lot. And I had a really hard time not rushing out of the room to run over and go and pick up a crying baby to do something to make it better, right? That sort of compassion and empathy that I was experiencing was profound, long before I became a parent. And so I went up to my professor and I was like, what is going on over there? He's like, oh, that's my lab. And I was like, okay, what is going on over there? And this was Doug Tady's lab, who's now at Penn State. And they were basically having children go through something called the strained situation procedure, which you may have heard about. And it's a series of separations and reunions with the caregiver to look at the quality or the security of attachment. And separations for 12-month-olds can be pretty stressful from their caregivers. And so that's the reason why some of those babies were crying, because they were either left alone in a room for a brief period of time or left to interact with a stranger who they may or may not be particularly interested in having any kind of interaction with. So that's how I got started. And that took me to the University of Illinois, where I studied marital relations, parenting, and the impact that those two family subsystems have on children's social and emotional development. From there, I went to the University of North Carolina to do a postdoc at the Center for Developmental Science. And then I went to Arizona State, which was my first faculty position. And along the way, I kept asking why? Why am I doing this work? And how can I use the results of the studies that I was conducting to actually change the lives of children and families? And that's where the rub has always been for me, in that translation of research into practice and research into action. And so I actually chose to leave academia after a couple of years and then worked in early childhood consulting, worked as a preschool teacher, and did a lot of applied work to try to see if everything I had learned in graduate school and in all my training I could actually use in some way to help support children and families. And then years later, I found myself in Dallas, contacted Margaret Owen and said, hey, I've got this idea. And Margaret, as you probably know, is a creator of one of the widely used systems for rating parent-child interaction quality. And so in that work, what we did together, as Candace was talking about in the beginning, is we took the research on parent-child interaction and used video clips to try to make that work accessible to parents and practitioners. And then after all that work, I came full circle, and here I am back in an academic setting, back doing research, now informed not only through the lens of my work as a practitioner and as an applied professional, but also as a parent, coming back in. So in every moment that I do this work, there's my training, there's my research agenda, there's my experience and practice, there's my experience as an individual who's been parented in my own life, and then there's the experience of me parenting. And literally all those worlds come together every minute of my day, which can be challenging. Many of you probably experience that same kind of tension and pull between working through your own developmental histories, being present to the children that you care for, and simultaneously parenting, right? So this is probably not something that's new. So I'm coming with you today through that lens of someone who's kind of come full circle back into a research setting, continually focused on the goal of, number one, being a self-reflective practitioner, using my own awareness to help to be with families in a different way, but also to keep moving the agenda to give practitioners, researchers, and parents tools that can really help shape interactions. So let's dive in and see where we go today. So I'm calling this a relational health perspective, whereas before I would have considered myself a marital conflict researcher or a parent-child researcher, I really see myself now as someone who brings a relational health perspective, and I'll try to share with you why I think that offers value. Okay, so my talk today was framed by a quote from my daughter when she was 5, poignantly coming, as many comments do from children, from the backseat of the car one morning. Mom, why are so many songs written about love, and why are the songs always so sad? Okay, I'll never listen to the radio in the same way again, right? One of those just quiet observations based on hundreds of hours of listening in the car of various songs. And she said, why? Like, what is it? Like, why is it about love, right? What is it about love that causes such joy and such angst, right? Those two things exist simultaneously in almost all of our relationships. And if it doesn't exist in yours, I'd love to know how you got there. So talk with me afterwards. And it really got me thinking about what is a relationship? Like, what does it mean to be in relationship with someone? And why do relationships matter? So, of course, I did what any person does, right? You go to Merriam-Webster and you say, what is the definition of relationships? And the dictionary gives synonyms like affinity, association, connection, which is what I'm going to focus on today, kinship, and linkage. And I love this little image of a connection. If you remember Jerry Maguire, I'm probably dating myself, but it was that idea that you complete me, right? There's something about you that makes me whole. There's something that works in me because of what you bring to the table, right? And we could argue about why that perspective is probably not the healthiest perspective, right? So I don't want to in any way say that that's the rosy-colored vision of how relationships should work, but it's the idea that we're a connection, that there's something there. You light up, right? When I turn my battery on, I turn my battery on, you light up, da, 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 right? So we've got these connections that go back and forth. Okay, so how many people have heard of Harry Harlow and Harlow's monkeys study? Okay, great. So I love this image, and I think it really, those studies I always show in my classes when I teach. There's some great footage on YouTube that you can watch of the original experiments. But I love this image. And so Harry Harlow wrote a paper back in 1950s called The Nature of Love. And we were really at that time trying to understand what is it, basically, that keeps an infant with their mother. Is it because of the food and the nurturance that that individual provides? Therefore, it really is about sustenance and about survival in that way, right? Because you have to eat to live. Or is it about something else that relationships bring that offers a different kind of value in terms of sustaining life? And the idea of contact comfort comes in there. So you see this image, and it said the surrogate was made of a block, and you can see what it looked like. Not maybe the mother we would all choose for ourselves, right? But compared to the wire monkey that was the counterpart that was feeding these rhesus monkeys, this looks like a dream, right? Warm, fuzzy, contact, snuggle up with, maybe where you'd like to be today, snuggled up with a blanket. I was joking about, binge watching Netflix under a blanket on a rainy day, right? That contact and the comfort that comes with being with something warm, something fuzzy. But what Harlow concluded is that the data obtained make it obvious that contact comfort is a variable of overwhelming importance in the development of affectional or emotional responses. Contact and comfort helps us to have a full range of emotional experiences. Okay, but beyond contact comfort, going back to my daughter's sort of provocation around songs, right? We see that relationships can bring us joy, exhilaration, nurturance, security. Relationships can be angels for us, like wind beneath our wings kind of idea, right? They can help us do things maybe that we couldn't do on our own. They can help us heal from our own early experiences. But relationships provide us with an opportunity to co-regulate. And this concept of co-regulation is, if you take nothing else away from today, I hope you take away that the idea of making a shift in our work with children and families from an emphasis on self-regulation to an emphasis on co-regulation is a very powerful and empowering shift. But again, relationships can come with some hard parts too, right? Disconnect, regret, grief, loss, separation, the idea that Selma Freyberg portrayed in her writing about ghosts in the nursery, which is in the moment of being with an infant, what gets stirred up in us that needs to be healed? Okay, so why are we studying relationships? Well, we know that relationships are associated with a range of outcomes and correlates in children and in adults, right? So we recognize that across a wide range of relationships, the positive relationship features, things like engagement, sharing affect together, right? Active listening, being able to have intimacy and self-disclosure. Those kinds of relationship qualities, which we tend to think of as positive relationship qualities, when relationships have those features, children and adults tend to do better, right? And we can pull from lots of different literatures, whether it's a literature on early parent-child attachment relationships, or peer relationships, or intimate partner relationships, or the relationships that you all have with colleagues at work, both those horizontal or colleague relationships, but then those hierarchical relationships with your supervisors, right? And in our own work, our research team has really been focused on the experiences of stress and coping in the work environment. Any of you work in early childhood intervention that are here today? Okay, any of you work in early child care, home visiting? Okay, so what you may be sort of thinking about is that there's a lot of pressures on your time and attention, yes? Yeah, and the caseloads that you manage, and the expectations to meet the needs of funders and to meet your metrics, and at the same time, where your heart probably is in delivering high quality services to children and families, right? And so that creates some stress and that creates some tension. And we've been working with looking at the value of reflective supervision and consultation for helping professionals to manage the emotional content of their work and to build their efficacy in the face when they may not have a lot of control over what goes on in the day-to-day demands in their work environments. And I'm happy to share with you some of that work after. So back to relationships, thinking about early parent-child relationships, most specifically is where we're going to focus today, but I recognize that many of the concepts that I'm going to talk about can be applied to a range of relationships. Okay, what are some of the challenges of studying relationships? I think this is a really important discussion to have. I think the methodology piece is huge because the extent to which we can deliver effective interventions and education efforts really depends on how good a research we can do, right? We need to do good research to get information about how to best work with children and families. But any of you who work with children and families know, working with children and families is not logistically always easy. Yes? Yes, okay, good, nods. I'm like, am I out here? And, okay, good, yeah. It's not always easy, right? When you're dealing with someone beyond an individual child who's your focus, you're introducing the amount of noise, right? And differences in scheduling and perceptions and buy-in and engagement and that's going on, right? So studying the family as a whole is challenging, right? What if you're going to observe family interaction, maybe a parent, a grandmother, and a child, but one of them didn't have transportation that day and couldn't get there on time. And so you show up and you're not able to collect your data, right? These are the logistics and the realities. And we can't look at those as reasons to get sort of angry about the work we do, but as a way to have compassion for the lives of the families that we work with, which is a really huge piece, right? At least my response as a researcher is like, inconvenient, I've got to reschedule, right? But if I can step inside the shoes of the people that I work with and ask questions and become curious rather than be judgmental, I can find a lot of reasons why what's going on in that family makes perfect sense, right? Okay, so engaging participation is one barrier. Coming up with the tools, what kinds of tools are available to really effectively study children and families, right? We've got lots of scales that exist out there, but how do we know what's good? And even the best of scale, if we can't use it in the home effectively, isn't much of a good scale from a practice perspective, right? So coming up with tools and systems of measurement, and also figuring out in which contexts are most important for assessing the constructs we have of interest, right? And I'm going to present some data where we found that emotional connection in one context, but not in another context, was what was the most powerful predictor of children's developmental outcomes, which was very reaffirming for my collaborators, but also really helpful for us in thinking, okay, then we're not going to bother spending a lot of time collecting data in other contexts because we know this is where we can get what we need. Okay, it's also important to recognize that different literatures focus on different features of relationships, and they don't always talk together, right? So you might be coming from a literature where a lot of the focus is on an individual construct, like children's executive function, and another, you're trying to talk with somebody who says, but yeah, but from a family systems perspective, you can't understand what's going on with children's function without understanding the ways in which parents are stimulating their cognitive development, helping them develop planfulness and, and problem-solving skills, right? So you might be working with people who have come from different backgrounds and literatures. I want to also acknowledge the importance of us as professionals acknowledging our power in any relationship when we're working with children and families. We're coming into a setting where we are making judgments, can be perceived as making judgments, and we're telling people what's right, not so right, what could be different about their families, right? And we have to be incredibly mindful as professionals that that automatically puts us in a position of power, and we need to acknowledge that. We also come with our own biases, right? We have perspectives on how families should work, how we think children should be at any particular age. And it's not that we'll ever get away from those biases, but just becoming aware and mindful of those can help us to show up to working with families in a different way. Also related to the idea of power and bias is this idea of delivering culturally responsive programming and having culturally responsive and informed methodologies. Right? So if you're going in and you're looking in a family where in that particular family's cultural practice, it is not the case that children, ask questions of their parents. I'm thinking about the last talk when I was watching the lecture, and how to work with children when they're asking lots of questions. I think that was Candace's talk, because children do, but maybe for some of the families you work with in their culture, that's not really what is desired, accepted, or a promoted practice. So do we say, oh, you're thwarting your child's development? Or do we say, let's think about what's going on for you and how it feels to be asked questions and how you're feeling about that and what that means for you and your culture? I just wanted to mention a funny thing that just happened in our lab group meeting the other day is that, when thinking about methodology for studying relationships, we need to think, again, about what we each bring to the table. I was reporting on some preliminary results from one of our projects, and one of my collaborators in the room, who is from an Asian background, she said, you know what? If you want to understand what's going on with mother-son relationships, you need to be asking the mother-in-law. And I thought, wow, that was something that I wouldn't have even really thought of, right? But what she brought to the table was helping me to broaden my lens on who the key players are in family relationships and who I need to be asking for information and who I need to be trying to understand, right? That mother of that son, her experience may be powerfully shaped by her perceptions of being judged by her mother-in-law, right? And I want to take that into account. So keeping in mind all the different voices we bring to the table based on our own cultural backgrounds, practices, and experiences. Okay, studying relationships is problematic too because there's so many relationships to study, true? Right? We can't do everything in one study. There is not enough money, time, bandwidth from our participants, so we have to figure out which relationships we want to focus on. I've provided just a range of relationships you might consider in your own work. It is in an effort to widen that relational lens to help you think about what other relationships your children and families might be experiencing that's shaping what you're actually seeing in your classroom or in your clinic or in your practice. Okay, so what is relational health? If I'm talking about advocating for a relational health perspective on development, what is relational health? I love this fairly recent paper. If any of you know Bruce Perry's work, he's a co-author on this paper. 2018 preprint that's available online that talks about relational health reflecting a sense of connectedness with attuned others. Connectedness with attuned others, right? So relational health has to do with people who are aware of us, or in tune to our experiences, and how those different parts play together in terms of connection. And it's wide, right? So relational health is a wider lens. It includes caregivers, family members, and the community, right? So moving beyond just to focus on parent-child attachment, a relational health lens is a community perspective. We're sharing the load. We're sharing the joys and the responsibilities and helping individuals thrive in the context of relationships. Okay, so the value of a relational health approach, I'm going to help you to remember this by the acronym of REACH. So a relational health approach has REACH. Number one, it reduces blame and burden and destigmatizes difficulty. In my own reflective practice work with Barbara Einstein and in conversations with Patty Miller, we talk about the use of a tool that helps us to come to see our personality challenges and strengths in a more collective, compassionate way. It's not that there's something wrong with us because we respond in a particular way. It's just that's how we show up. And understanding each other's kind of nuances and personality quirks and strengths and so forth can really help us to connect more deeply with each other. And that's the value of a relational health approach. It doesn't say there's something wrong with that parent. So it doesn't say there's something wrong with me as a parent, that I'm insensitive and I'm intrusive. And it doesn't say there's something wrong with my child, which is that my child is non-compliant, they're aggressive. But it looks at the relationship, what's going on between the two partners, right? If my child is behaving in a manner that I perceive as aggressive and I feel uncomfortable about that, I may get more intrusive in my behavior in an effort to stop that, which then could increase my child's aggressive behavior. So we're looped together, right? We're looped together. And parents affect children, and children affect parents. Before I became a parent, I actually really thought that if I just followed the textbooks, that this magical child in front of me will just respond in a textbook manner. That's how naive I was, up until 15 years ago, like really, right? But my children affect me. They elicit things from me. And you saw that in the first talk if you came to the first lecture, right? When we're talking about what happens when your child has asked you, but why is it that case 50 times and you're at the end of your bandwidth for the day? Or why, if you're out in a setting and someone comments on the color of someone's skin or the shape of someone's body, why can that make us so uncomfortable that we just say, stop saying that, that's not polite, right? And so a relational health perspective helps us to step outside of those individual blames and attributions and help to see the dynamic of what's going on within our families. A relational health approach also emphasizes the establishment and maintenance of connection, which I think is really palatable to people. We want to be connected, right? We are by nature social creatures. We want to be connected to each other. And connection is a process. So relational health offers the value of there's not something wrong again, but it's a process of where we can become more connected and more attuned to each other. So a process focus that decreases blame and stigma when there's problems at the relationship level. A relational health approach acknowledges how relationships impact health and well-being across the lifespan. This is a developmental approach. Relational health starts when infants are in utero, right? It starts in how that expectant mother feels about that developing fetus, whether that pregnancy was planned, not planned, whether they can have concerns about whether their own family history of mental illness is going to be carried over for their child. We start those relationships in utero, and we continue them to the end of our life. We also find that a relational health approach considers the role of other, right? A relational health approach isn't an isolated approach. It recognizes that others are powerful co-facilitators or co-supporters of relationship health. And if you think about that, for example, with the Juego Conmigo, Crece Conmigo programs that have been implemented at UT Dallas, it's very much this idea that in being together with people who support you and who believe in you, we're helping to build stronger relationships within families, right? So again, it's not that you have to be an island. You've got to figure this out on your own, and if there's something that's not going well, it's because you're not doing something right. And then finally, a relational health approach offers hope. And this, again, I think is a really powerful take-home message. We get into patterns where our relationships work and don't work more or less, yeah? Like if you have relationships that have been perfect and joyful and happy your whole life, again, talk with me afterwards. I'd like to know what's going on so that I can learn from you. But there's hope, right? And a relational health approach offers value in repair. Okay, that didn't go well. But we can come back together and say, I was really scared that you were going to get hurt, and I responded way too harshly when I yelled. Can you tell me what you were feeling, right? And there's repair. And I can't remember, Margaret, maybe you remember the number, but the person that we worked with from the University of Chicago who gave an actual percent of how much a relationship works and what percent is repair. Do you remember the repair was way bigger? Yeah, the repair was way bigger, right? So if we start just validating people by just saying, okay, yeah, maybe that's not going great, but let's look at the repair. Right? Every weekend, my family is running to Home Depot to repair something. Right? Our relationships are similar. Right? It's just we need to get the tools from the store that we can put together and help to make things work. Okay, John Bowlby loved this quote, recently included in a paper that I wrote with a developmental pediatrician and a co-parenting colleague. If a community values its children, it must cherish its parents. Right there, relational health in action. Right? We have to cherish parents if we are going to help them be effective in their interactions with children. Okay, so how do we come up with this sort of idea of relational health? Well, it comes from lots of different approaches. If there's any clinicians in the room, the idea of relational health is probably really familiar to you. It's probably a phrase you've heard in your own work. If you look at clinical blogs on the internet, you'll see lots of evidence for this phrasing of relational health. But we're starting to see it more and more in research. And I like that sort of wider lens again. And where does it come from? Well, it really stems from what I see is 3 theories, but there's certainly many more, and I want to recognize those as well. Attachment theory, probably what you have heard of the most about in your own work. Bronfenbrenner's bioecological model, which is a kind of person, context, gene interaction model. And then calming cycle theory, which has been developed by my colleagues, medical Dr. Martha Welch at the Nurture Science program at Columbia University, in work that she's been doing that's come out of her work in the NICU with infants who were born prematurely. You could also consider family systems theory. The whole field of infant mental health is based in a relational model, the idea being, Winnicott said to paraphrase that there's no such thing as a baby, only a baby and someone, right? And so we see this evidence of relational health in lots of different places. Okay, so Ainsworth's attachment theory, the sort of A of the ABC foundations, is applied across the lifespan. There's been a number of interventions like circle of security, attachment and biobehavioral catch-up that have focused on supporting healthy attachments, secure attachments, primarily through helping parents become more responsive. We think of these relationships typically as being secure or insecure. If you have done a lot of reading in this area, you might know about the disorganized attachment classification as well. But the idea is that to increase parent-infant attachment security, you increase parent sensitivity. Right? So it's very much aimed at the level of supporting the parent in being more responsive in their caregiving. And that's where a lot of my earlier work has been in this idea of parenting sensitivity and attachment. But attachment has been applied in our romantic relationships, right? You might hear about attachment styles, whether you're avoidant or dismissive or preoccupied, whether you fluctuate, things like that. And we also think about attachment in terms of the intergenerational transmission of attachment. I like this longitudinal perspective from attachment because it says, like, if we know that a parent has had a difficult developmental history, a lot of adverse childhood experiences, has, still a lot of grief in their own relationships with their parents, how on earth could we expect them to be present to the emotions of their child, right? That seems like a heroic effort to expect that when there's so much unresolved grief and feelings that parent still needs support in working through, right? And one of the pieces that has come out of this literature is the idea of reflective functioning. Have you heard that term before? Reflective functioning? So in one of the measures that's used to evaluate what we call adults' retrospective reports of their own childhood experiences and their representations of attachment, the idea is not so much what parents experienced, but their ability to reflect on those experiences in a way that's coherent and whole. Does that make sense? Right? You could have had a really difficult developmental history, but say, you know what? Like, this was really hard, and it caused me a lot of grief. And I really, tried to understand from my mom's perspective, that she had been a single mom, and she was doing the best she could, and she had experienced abuse, and she didn't know how to love me. And so you're telling the story in a way that's coherent and whole. But parents need support to break those intergenerational cycles of poor parenting or insensitive parenting and of insecure attachment, right? And so the promise in this kind of perspective is we can work with parents to become more organized and more reflective on their own experiences so that in the moment they don't respond to their children in the same way that they had been responded to, right? There's that beautiful pause when we feel something and then we take action, right? The power's in the pause, and just getting people to be more mindful and reflective of being triggered is a lot of what a model like Circle of Security does. And they have a great website with lots of information and tools available. Okay, so John Bowlby, I think, had it right when he was talking about, if we're understanding children's attachment processes, we look at that process of connecting. We have to deal with loss that happens when we're separated. And sometimes we, come out feeling closer to our caregiver as a result of going through some difficulty. And sometimes those experiences of separation and loss don't get repaired. And then that's kind of, thinking from a relational health perspective is how can we work to repair when grief, loss, and separation is evident. Okay, so this is on the slides that'll be available, but I think a really great book that's come out of the Circle of Security intervention is this Raising a Secure Child that talks a lot about making the literature on attachment and the Circle of Security intervention very, very user-friendly and concrete for people who work with children and families. So if you're looking for something new to incorporate into your practice, your parenting, your thinking, it's a 2017 book. So the B, what underlies relational health, is the idea of Bronfenbrenner's bioecological model. Bronfenbrenner said in order to develop normally, essentially, you need an adult who's crazy about you. Right? I love that. That's sort of irrationally crazy emotional relationship. So Bronfenbrenner was recognizing both the power of the relationship and the power of that emotional experience that a child can share with someone who believes in him or her. And from a bioecological perspective, it maps on well with relational health because it recognizes that individuals are situated in a system of relationships, right? How I interact with my children is inextricably tied to how I'm interacting at work and what's going on for me at work. So even though my children aren't with me at work, they're experiencing some of what happens with me in my day-to-day stressors of work, right? Can you relate to this? Bad day, come home. Before you walk in the door, you have this great attention. You're going to make cookies and make a nice dinner and have this lovely relationship evening, and then you're met with your child who is maybe a little grumpy, irritable, wants all your time and attention, could care less about this nice dinner, right? Or is this just my life? Yeah, okay. And so that's it. That's the value, right? Is recognizing that the child's bringing something to the interaction, that there's these nested systems, that these relationships impact each other. Okay, and so let me introduce calming cycle theory to you. And I am a student of relational health. I do not proclaim to have all the answers. I am every day learning and growing in my own relational experiences and in my understanding of new theories that are helping us to understand children and families. So my colleagues at Columbia University, the Nurture Science program, have worked extensively with children who have been in the NICU. Right, so NICU experiences are inherently stressful. Right, the newborn is separated from the caregiver, sometimes for very long periods of time, months at a time in some cases, right? Parents may have limited resources, time, money to go back and forth to the NICU, right? So just to show you my naivete, the first time I walked through a NICU, I was like, why are none of the parents here? Why are none of the parents there? Because those parents have their baby in a NICU that's an hour or more from them. They have to take public transportation. They don't have leave. They don't have a way to fund their other children, their families' lives. So they need to save up their money and leave so that when that baby comes home, they can be with that baby, right? So, humbling moment there. I was like, what am I thinking, right? NICU experiences can be stressful. And so out of these NICU observations and experiences, Welch and colleagues have generated a theory about how infant, mother, and they're focusing on infants and mothers at this time because they're working with babies who are biologically born to a mother who will be caregiving for them, okay? So I just want to be clear about that. But calming cycle theory proposes that the mother and infant co-regulate one another. Right? And I think that process of co-regulation is really important to acknowledge that it starts very early on. So Welch and colleagues acknowledge that it starts in utero. This process of when the baby kicks, are you saying, wow, you're feeling really active today. I wonder what's going on. Are you getting excited? Right? And there can be a co-regulatory process that emerges even when that child is still in utero. And then if you look at the pictures that are evident in this slide, what you'll see is this is very different than models of self-regulation, right? Where the mother is regulating her own emotional experience, the child is regulating his or her own emotional experience, and they're together, right? I would argue a lot of us do a lot of this, right? which is I'll keep my stuff together, you keep your stuff together, and we'll be together, right? And that's the idea with self-regulation. There's psychological co-regulation, which is really when our minds are kind of connecting together, right? And in my own experiences with my children, I did a lot of psychological co-regulation. But as I learned more about emotional connection in this co-regulatory way, I start to shift that from thinking up here, trying to connect with my kids from my head, which was like, oh, what's going on with your day? How are you feeling? What's the emotional response, right? To learning to be with in a co-regulatory, more autonomic sort of capacity. And that's important because I just want you to bring to mind one person that when you see them, you feel something in your body. Do you have anyone like that in your life? You either feel butterflies, or you feel like you're nauseous, or you feel something, right? There are these physical responses, these physiological responses that we can have in interaction with other people. And that is what I became really aware of in doing this work, is that if I could sit long enough with the people that I was working with, the children, the families, my own relational health partners, to feel that cycling going on, I became very aware of the extent to which there's kind of a matching that happens there in terms of our breathing rates can start to get in sync, our heart rates can start to get in sync, our eye contact deepens the feelings of connection, and I would need to do a lot less psychological regulation of the experience and a lot more of just being present to what was coming up. So it's a really powerful shift in thinking about co-regulation. The emphasis in calming cycle theory is on a dyadic level connection, so not just what's going on, say, for example, with Jackie sitting next to Margaret, but what's going on between them. So it's an emotional dyadic construct. Again, thinking physiologically, and again, emphasizing repair. The value is in the repair. But by calming interactions where you can take the time to just be present to the uncomfortable feelings, to be with those feelings, and to get into a more feeling state of synchrony, that can help build emotional connection versus talking about each other's feelings, which is certainly important, labeling, going into the cognitive realm. Does this make sense? Okay. Okay, so on the left, we see an example where there would not be a co-regulatory emotional connection, and on the right, in the blue, is we see that connection, right? So we see them moving towards versus moving away. Now, I want to emphasize as I'm showing some images that it's not the case that people are going to be in this perfect blue state over here all the time, because that's not the reality of parenting, right? So we would be hesitant to make judgments based on one moment in the shopping mall. You're walking around Collin Creek Mall or wherever y'all go, and you see a baby and they're pushing away, and you're like, oh, not connected, moving on, right? And so as I'm showing these images, I want to emphasize that it's a pattern of relational experiences that we want to emphasize. Okay, so emotional connection is mutual, autonomic, measurable, and actionable. She probably didn't know that she came up with the acronym of MAMA, but she did. So co-regulation reflects a shift in messaging. It's a foundational process for the development of health and wellness. There's a relational context of development, and it's not something done to a child. You don't need to be more, say, for example, more sensitive, more responsive, but it's a way of being with a child. And again, I like that value of sort of destigmatizing the burden when parents are already so burdened in what's going on with their own experiences, right? So it makes it more of being with. Okay, what factors might affect emotional connection? One of the examples that I was mentioning earlier was the experience of premature birth and the NICU experience. And the family nurture intervention has this lovely graphic that you'll all be able to see on the slides, but it talks about helping parents, and in this case, helping moms to connect with their infants who were born prematurely through 4 different emotional modalities. So vocal soothing, right, the power of the voice, comforting touch, so actually applying touch and pressure in a way that for a baby who was born prematurely, that it actually helps to calm them down rather than agitate them. Eye contact, working to maintain eye contact, and then also holding. And so again, that sort of contact, comfort that Harlow alluded to in the beginning. And so this will be available for you all to take a look at, but what they found is that they're found in a randomized control trial, what they found is that dyads who participated in the family nurture intervention are receiving significant benefits, not only just to the mother and to the child, but also to their relationship. So they found that the family nurture intervention participation in the FNI has been associated with more positive maternal caregiving behavior, with changes in levels of maternal anxiety and depressive symptoms, where the experience of participating in FNI has decreased their anxiety and depressive symptoms, and also in lower developmental risks for infants on a variety of instruments, including the MCHAT. What's interesting about this is that it's showing benefits for both partners, right? It's helping to get those two connected in a setting where it's sometimes hard to connect. If you've been in a NICU, you see the tubes, you see the noise, you see all the things going on, right? And it's a very different experience than bringing a full-term infant home with you who you can hold and care for immediately, right? So it may take work to get those two connected, and the FNI seems to be a powerful tool for helping that happen. Okay, so I want to talk next about a new measure that has come out of this work at out of Columbia based on the FNI, and it's called the Welch Emotional Connection Screen. And I hope that in this discussion today that you can take something out of this that you can immediately apply in your use with children and families, or if you don't have a child or a family to work with, immediately try it out on a partner, spouse, or somebody else in your environment and see how it works for you. So the focus in the WEX is on 4 mutual dimensions. So it's a rapid screening tool for relational health. It can be completed after as little as a few minutes of face-to-face interaction. The face-to-face interaction piece is the key, right? In a lot of my own research and a lot of the research that we do as developmental researchers, we do toy-based play, right? We have parents play with their toys. Can you think of what the challenge would be with toy-based interaction when you're trying to assess emotional connection? Distraction. Yeah, because you can focus on what? Yeah, exactly. You can focus on the toys instead of on each other. And in modern day, you can think about this as we're going out to dinner and we're each on our respective cell phones, right? Like we're together, right? But we're focused on something else other than each other. So the face-to-face interaction between an infant and a parent is a powerful elicitor of what's going on at the emotional level. Okay, so you'll notice that a lot of these scales are really similar to the kinds of things that have been widely studied for years, like parenting sensitivity or facial expressiveness. These aren't new ideas in terms of what we're actually measuring, right? What's new is that we're measuring them directly at the mutual or dyadic level, and we're doing it in a rapid setting as a rapid screening tool. So that's the shift, that's the newness there. And based on the patterning of behaviors across these 4 dimensions, people who are working with the screen assign assessment of emotionally connected or emotionally not connected, not emotionally connected. So EC positive or EC negative. So EC positive means great. There appears to be evidence that there's a mutual connection going on here. EC negative means that it's not present in this observation. We can either watch it again over time, right, to see maybe the next interaction. What are we seeing again? Do we see the same things? Is it time to maybe make some recommendations, right? Or is it that there is something really deeper that's going on that really suggests more of a significant relationship disturbance? And then in talking with families, you could generate an approach that could help them to think about ways to get more connected, okay? So a couple of EC positive, EC negative examples. And so this one right here. So take a look just at this stock photo, right? I use stock photos just to keep it clean. What do you think here? Yeah, not mutual, right? The baby's looking away, the mom's smiling, so there's not a matching of affect there either, right? So there's not a matching in affect, there's not mutual attraction or engagement to each other. It looks like they're both communicating. Baby's probably crying, which is communication, and the mom might be trying to soothe. But it looks like if the baby's really that distressed, then maybe smiling and maybe prodding or tickling or doing things like that. I'm telling a story about what this mom could be doing. Maybe that's not really what's needed in that moment to create connection. Okay, let's look at this one. Yeah, look at your responses. You smiled, right? You smiled, you chuckled, you laughed. What do you see going on here? Yeah, it's mutual, right? They're looking at each other. The mom's leaning in. This is an actual participant in one of the studies. They're communicating. You can tell through their facial expressiveness. It looks like they're in sync, right? You get that feeling that, wow, they're together in this. There's mutuality, right? There's emotional connection. And then what about this one? Right, bad day, right? Right, one bad, this does not mean that they're emotionally, not connected forever, they're not emotionally connected, but it's just an exaggeration to show you that if this was a pattern of interaction that you saw, where they're both not approaching each other, where maybe there's not a positive expressiveness going on, what did you say? It needs repair, right? It's a relationship that needs repair to get in sync, to get that co-regulatory capability going. Right? Being with a crying baby can be distressing, yes? Yeah, and acknowledging that can just be the first step. It's like, okay, this is hard and you're upset and I don't know what to do, but I'll be here with you, right? That level of empathy can be very powerful. Okay, so I want to tell you a little bit about results of our study that we did with this measure. I know we got started a little late, but I'll be sure to leave some time for questions. First of all, I want to present results from Amy Haynes' work. So Haynes et al. Did a study with infants that had been in the NICU. She studied them at 4 months, and she looked at, okay, so if we use this measure of emotional connection, the WEX, what's going on with these babies and moms? And so they had a couple different measures of interaction, and what they found overall is that the WEX is mapping on in meaningful ways to infants' own experiences of dysregulation and how they're approaching their moms. So it's kind of a way to say, yeah, when we're connected, I approach you more and I can regulate my distress better. Okay, does that make sense? So infants in EC negative or not connected dyads displayed autonomic dysregulation and a less approach-seeking behavior. Again, a complex way to say, I'm having a hard time keeping it together over here, and I'm not looking to you to help me. I'm not approaching you to help me regulate my distress. And EC is rated by the WEX overall was found to be associated with healthier infant biobehavioral stress responding. So this first study let us know that among preterm infants, using the WEX seems to be meaningful. It seems to be a valid measure in that it's measuring what it's supposed to be measuring. If you're connected, connection should help you regulate your distress and elicit approaching your caregiver, right? And that's not what they found for those dyads who were not connected. In our own work, this just came out actually this week, we studied EC in a full-term sample. And so we actually took some data that I had collected years ago, got out the videotapes and said, okay, let's try using the WEX with a sample of full-term infants and their moms, and seeing if we can predict, it was a longitudinal data set I had, seeing if we can predict to the child's level of internalizing and externalizing behavior problems 2.5 years later. So we coded with the WEX in 2 different paradigms. The first paradigm was toy-based play, which is what we typically do in our research, right? And then the other was a brief face-to-face interactive paradigm. If any of you are familiar with the still face procedure, it was the first couple of minutes of the still face. And we coded the WEX, separate sets of coders, to code each of those paradigms. And we looked at what happened in terms of mothers' reports of children's behavior problems 2.5 years later. And what we found in this study was that, if you look at the graphs over there, is that when infants were rated as not connected with their caregivers at 6 months, they were rated by their moms as having higher levels of externalizing and internalizing behavior problems at age 3. Right? So the experience of being connected, which is what you see right down, let's see. Sorry, I went the wrong way. Wait. Okay, so I'm trying to find the thing. So if you see right here, you can see that being connected was associated with significantly fewer behavior problems in the face-to-face paradigm, whereas being not connected was associated with significantly more. But what you see over here is that there was no difference in the toy-based play paradigm. Toy-based play isn't getting at emotional connection. right? It's not getting at it in the way that this face-to-face interaction, I think in part because what our attendee over here astutely observed, is that you can put the focus on the toys rather than on each other in the relationship. Okay. So this, again, is giving us evidence that the WEX holds promise as a valid relational health screening tool. We now have it based out of the FNI. We now have it at 4 months corrected age with the infants in the preterm sample. And now we have evidence with the full-term sample that it's relating meaningfully to behavioral outcomes. Okay, our second question is, how does emotional connection relate to ratings on an established measure, right? If we want to say that this measure is going to be valid and people should be using it, we should compare it to existing measures. And so what we did is then we recoded all those interactions using the NICHD rating scales that Margaret Owen had adapted into 5-point rating scales, and we compared the WEX ratings of emotional connection to the examples or to the various scales from the mother-infant interaction rating scales. And what we found was that those two measures were related in meaningful ways. We looked at sensitivity, detachment, intrusiveness, positive regard, negative regard, animation, positive mood, negative mood, sustained attention, and dyadic mutuality. And what we found is that mothers who were in dyads where mothers, let me take that back. In dyads rated as emotionally connected, mothers were rated as significantly more sensitive, less intrusive, less detached, more positive, and less negative on the mirrors. Children were rated as significantly more positive and less negative, and they exhibited higher sustained attention. And then at the dyadic level, right, in those NICHD rating scales, the closest we have to emotional connection is a scale called dyadic mutuality, which looks at the dyadic level, what's going on between them? Is there some shared enjoyment, some shared pleasure? What's going on? And at the dyadic level, we found that EC-positive mother-infant pairs exhibited higher levels of dyadic mutuality on the mirrors. So we're seeing evidence that the WEX is tapping in meaningfully to measures of relational health that have been widely used, although how they're being measured is somewhat different. Does that make sense? Yeah. Okay, so a lot of correlations, if anybody wants to look at those later. And I'm going to skip that part. But so one of the big questions that comes up next is, what about fathers, right? And what we have found so far is that father-infant EC, as assessed in the face-to-face and in the toy-based play at 6 months, isn't related significantly, statistically, to mothers' ratings of children's behavior problems. Now, does that mean that the WEX can't be used with fathers? No, we're not there yet. We're not there in saying that. There could be a couple of different things going on. Number one is our cohort was from the late 1990s when those data were collected, and fathers are more involved in parenting now, right? So it might be simply that we need a new cohort of dads to look at these processes with. It also could be that it's our outcome measure that we need to think about and broaden in terms of outcomes. For example, the literature suggests that father-infant relationships and father-child relationships may be particularly important for children's executive function. Our outcome measure was very limited in that it was only mothers' reports of children's internalizing and externalizing behavior problems. Okay, so I'm going to just scroll down and let's see if I can get. Oops. Hang on for a minute. Oh, there we go. Okay. I'm having problems getting there. Let's see. Okay, good. And I just want to just tell you a little bit about next steps in the last minute or so that I have before I can take some questions. And so what we're doing next is we're extending the use of the WEX into applied settings. So we're saying, okay, we've got some evidence to suggest the WEX can be a meaningful, reliable, and rapid screening tool for infant-parent relationship health. Can we train home visitors to actually use the WEX in home visiting settings with their families, right? So home visitors do a lot of assessment and a lot of direct work with families and children, and helping them have a tool where they could really quickly see what's going on, get a pulse on that relationship, might be powerful in terms of informing future practice. So that's what we're working on right now and trying to bring that together. The summary and take-home messages that I hope you leave with today from this discussion, which has been partially conceptual, partially theoretical, and then partially some data, is that a relational health approach to child development offers reach, and emotional connection is part of that relational health. Emotional connection is a mutual construct reflecting a physiological process, not simply a cognitive or psychological one. And then I hope you can see from this preliminary evidence that's now starting to get out into publication in 2018, now 2019, and other ones forthcoming, that the WEX holds promise as a valid, rapid relational health screening tool. And then I hope you can see how widening your own lens on parent-child relationships to include the concepts of emotional connection, co-regulation, and how children impact parents as much, if not more in some ways, than how parents impact children, right? So children to parents, parents to children. Hopefully this relational lens will help shift your perspective and help you to deepen the work you do with children and families. In a paper that David O'Banion and Sarah Shapi-Sullivan and I just wrote for a pediatric journal, we noted that maybe even if we can't shift practice immediately, we can shift perspective. Right? These are some lofty goals about building connection and getting everyone co-regulated and getting in there and having an impact. But maybe if we as the professionals who work with children and families and who are in the experience of having our own relational experiences, is if we can shift our lens on relationships to think about co-regulation and connection, that is a powerful first step in actually transforming the kind of practice that we do with children and families. There's lots of unknowns. We need to obviously apply WEX to a more diverse sample. We need to see if you can actually live rate doing this, right? So doing this in a research setting is very different than doing this live, say in a pediatric setting, right? Or in a home visiting setting where there might be other people around, lots of things going on. How are we actually going to do this? What's this going to look like? And we don't know if actually building professional capacity around emotional connection actually changes emotional connection within families, right? It's something we have to acknowledge, that we want our practices to actually improve the lives and enhance the lives of children and families. So we need to see how that works out. And we'd like to see how the F&I can be adapted and applied effectively outside the NICU, taking those ideas that have been so powerful in the NICU and making them accessible to others. My colleagues at Columbia are developing an intervention called Cuddles and Calm, which I love the name. I think it's so accessible for helping dyads get connected in settings outside of the NICU. I left on your handout a 3-step approach for building relational health within families, about promoting EC directly, things you can do, about supporting the well-being and efficacy of those who care for children and families, and about messaging the literature on co-regulation and relational health for parents, professionals, and community stakeholders, right? So this is the way we can work on it directly, and we can support those who care for children and families, and we can take that wider lens and tell other people why a relational health perspective is a good buy-in, it's a good investment, right? Which is what we're often trying to do, convince funders of why the work we do matters, right? And you've got 3 sets of recommendations that are on your handout for thinking about that. I want to acknowledge my relational health partners. I always feel like I should start there, because without the relational health partners that I work with, I would not be able to do the work that I do. So I recognize that I am a student of relational health. I am a student of emotional connection. I don't have all the answers. And these are my thought partners. These are the people that I work with in thinking about how to work with children and families. And I invite you and encourage you to contact me if you see ways in which the WEX could be useful in your own work, if you can see ways in which we might think about things differently based on your own experiences, or if you have a voice that you'd like to add into the conversation, I encourage you to reach out and talk with me. And so there's my crew, and I want to particularly acknowledge here Jasmine Lecourcier right here. She's a UTD Human Development and Early Childhood Disorders Master's graduate from my best of my memory. And if it wasn't that particular, I think that is. It might be neuroscience as one of her other areas. But she's a graduate of the program here at UTD, and she has gone on to Columbia to do great things in being the assistant clinical director for the Nurture Science program. So at the bottom bottom of your handout, you've got lots of resources and suggestions for how you might think about incorporating this work, and I hope that I've offered you something of value today. I'm happy to take a couple questions. I know we got started a little bit late. The rainy day kind of always does that for those of you who braved the highway today. Is there anything I can address for you? Thanks. Thank you for being here. I appreciate the opportunity to try to co-regulate with you all today. Any questions? Yeah.
So one thing I was curious about is when you're working with infants who have colic or have very severe issues where they have mostly negative emotions that they're producing. And that can be really hard to parent, not like I'm speaking from experience or anything, but it can be really hard for the parent to figure out how to respond best. And I wonder if they would end up looking like they have low emotional connection, in part because of all that negative affect during that particular age range.
Yeah.
Yeah, that's a great question, because and that's recognizing what children bring to the relationship, right? And so I think colic is a great example. Other kinds of developmental delays can contribute as well. Other medically fragile infants, aside from NICU, there's lots of ways in which children's interactions with parents can shape that co-regulatory process, right? So in that case, I think the affirmation is, this is a relationship, right? And that regardless of what's going on with your child, you can be present to that experience. And it can be hard, and it can be uncomfortable, and this is probably not how you envisioned your parenting evenings going, sitting with a colicking baby for 3 hours, right? But just being present, softening into that experience of holding, right? Using soothing touch. Some babies with colic, as you probably discovered, respond really well to being walked or carried. So being able to provide that nurturing contact, physical contact and connection, even if the vocal communication might not all be in sync all the time, or the affective facial expressiveness, and also mirroring affect, right? Like there's a powerful experience when your baby's crying, you just look at them and you're just like, it's sad, rather than be like, it's okay. Like I think our natural inclination to be like, it's okay, but that's not what the experience is for the baby. So in that case, I think affirming the relationship, recognizing that it's a co-regulatory process, that it happens over time, that your baby will outgrow colic, right? And that just softening into the modalities you can use for emotional expression, which would really be vocal touch or vocal contact and the nurturing touch, I think would be a hopeful message. Does that make sense? Yeah.
Can I add just a tiny bit?
Sure.
I think part of the success that we've had with babies can often be understanding the time, letting a mother understand that she has times during the day when she is feeling more healthy, she's not so tired, she has more energy, often that's in the morning, and also understanding that if mom can identify when the worst times of day for the colic or whatever, what those times of day are, and if she's tired, if mom is tired by that time of day, to give herself a lot of space. If the swing is all that's available and baby's going to cry for an hour, it's okay for you to let him cry for the hour in his swing while you check in on him periodically, but to just give yourself a little break.
Yeah. I thought you were going to go with, if that's the hour when you're really tired, just give the baby to someone else. That's what yeah. Hi.
Did you, in your detailed statistics, did you find any difference between a male baby or a female baby?
Great question. Yeah, go ahead. Do you have a follow-up to that too?
And I was just going back to, the relationship with the dads, because I raised boys, and I found that, even around 3 or 4, like when you drop them off at the daycare, they might act up if I drop them off. They never do that when their dads drop them off.
I think what your question beautifully exhibits a family systems approach right there, because you're saying what goes on in my relationship with my children that doesn't go on with my my partner's relationship with their children, and why might that be, right? Does it have to do with the child's gender, right? That's one question. Is it because they're boys and they're being with their dad and he's dropping them off? Is it context? Is it that I'm more nurturing or more kind? I'm not as hard, I don't know what stories yeah. I'm just telling a story that I think might fit. But so to answer your first question, overall, we did not find any gender differences, any main effects or interactive effects, but it's a reasonably small sample. With more power, it's certainly something that we will always look at. Where you're getting at in terms of the relationship between parent and child based on parent and child gender is actually really interesting. And one of my doctoral students is actually looking at that question in our All About Parenting project data. So I will let you know what we find out from that. But I think it's a really great question and recognizes what the child brings. The child's bringing characteristics, right? So thank you for that.
I just want to say thank you, Cindy. And
for
it
having
is
me.
Leighton, just like it happened at our first lecture, everyone wants to stay around and talk a lot longer, and maybe we need to change the amount of time we have for these lectures. It's wonderful, and I have a million things I want to say and I want to talk to you about. But thank you all. We have, food and coffee outside, and so it could be more reception talking time out there. And I want to remind you that we have our third lecture of the series just next week, next Friday in the same place. Dr. Margaret Kai from the University of Georgia will be here, a longtime colleague of mine, again, and that'll be fun. And she will be talking about fathers, so, come back, and fathering and the fathering data that we're gathering and are seeing results of. So thank you all for being here, and thank you so much, Cindy.
Thank you for having me. It was nice to be here today.